which brings me to my next question. And I wrote this one down. So I actually was reading this, and it quite honestly kind of confused me. And it was from Reggie Gold's. Actually, it was on your book about Reggie Gold making the message simple, and it was his paper he wrote to get his PhD. And in there, what he writes, and this is my question. It said he talks about how innate intelligence is always 100% in living matter, and it's always perfect in quantity and quality in both health and disease. That's what got me confused. How can innate intelligence be 100% in a diseased person? Because isn't that, even though we're not treating symptoms, if to me it always seemed that one of the reasons, not the reason, but if a person isn't fully expressing if they don't have a full expression of innate intelligence in their body can't be at 100%. So once you say if a person's subluxated, they would then, I think, have to have less than 100% innate intelligence expressed in their body.
Yeah, but I think the difference is, and you've just pointed it out, is the difference between the existence of innate intelligence and the expression of innate intelligence. I sometimes don't express myself as an intelligent person.
Well, I disagree, but anyway.
In fact, sometimes I try to express myself and don't express myself intelligently, and yet.
You mean like I did earlier when I was trying to recite the first principle of chiropractic?
Right. You just
I know it, but I couldn't express it.
That's right. Yeah, it didn't get out.
No,
and that's what happens with a subluxation is that the way the body should work, it was meant to work and was designed to work, just doesn't get out, and that occurs primarily because of an interference in the nerve system, and rather than the ability to express yourself. And you just had a kind of a mental subluxation at that particular point of time, which is fine. We express ourselves poorly, and sometimes we express ourselves poorly simply because of our ability to express itself. I can remember one time I was joking at the dinner table with my daughter, and I said to her, I'm just pulling your leg. I was kidding with her, and I just pulling your leg. And she looked under the table and she said, "You're not pulling my leg." So because children have a tendency to look at things very literally, and she didn't understand that figure of speech that I was using her. And I think that the thing is that our chiropractic is literal. And saying that my innate intelligence communicates with your innate intelligence is not literal.
Right.
That's I don't know what that is, but it's not literal.
Right.
And I think that's the difference there. So I think that we need to make that distinction between having an innate intelligence, holding that mirror up to you and saying that okay,
I gotcha.
The breath is there, but it's just not being expressed, and sometimes that occurs now. That's why they have changed it to holding a mirror to a person's nose, and seeing if there's any brain waves that are being expressed, because that even the breathing is not necessarily a good criteria anymore.
Right.
It used to be if you listen to their heart and it stopped beating, then they were dead, and they didn't have they no longer had an innate intelligence. But now we know that they do heart transplants, and people can not express a heartbeat for long periods of time while they're in the process of having that transplant done.
Right.
So it's really the expression of the forces of the innate intelligence of the body that we're looking for.
So as long as we're alive, whether we're healthy or sick, we still have 100% innate intelligence present, but it's just not being expressed, is the point.
Right. And it's expressed, it's being unexpressed to various degrees. And one of the things that causes it to be less expressed or express to a lesser degree, is the vertebral subluxation.
Right.
And that's why we correct
And
vertebral
that's our job.
subluxation. Yeah, and
Yeah.
I remember that a fellow once told me he was so excited that he was being asked to get on the staff of a hospital, and he thought that was such a great thing. And then he said that one of the doctor said, he wanted to check somebody's spine who had been just pronounced dead, and he said. And the doctor said, no, you can't check their spine. And he said, well, what am I going to do? Hurt them?
That's true. It's not going to help them, not going to hurt them, so I guess it doesn't matter.
So, but he was thinking that, well, maybe they're really not dead. Maybe they just are not expressing, not expressing enough life to be able to determine that they're alive. And so he said that's when I decided I didn't want to be on the staff of a hospital if that's the criteria. And I thought that was so apropos in understanding that what we're dealing with is the expression of the innate intelligence of the body. Now, there's a certain point where the body no longer expresses innate intelligence, whether that has a theological or a religious application, or whether it is totally a theological or religious thing, I don't know. But I know that if there's an innate intelligence in there, then there's still life in their body, and they need to have their spine checked.
Absolutely.
For that reason.
Well, there you go. I think that's a perfect spot for us to conclude today, and just that's the whole point of chiropractic, allowing that expression of life with the adjustment. And if we can focus our attention there, we got a big job to do. And so,
that's right.
because everyone needs it. Everyone needs that. So it applies to everybody. So I think the major lesson I learned today is that we got to always keep studying. You're studying the green, or Stephen said this morning, and it never stops. And that's why you are who you are, and you're such an inspiration to me and so many people, because it just oozes from you, chiropractic knowledge. And so I thank you again for taking the time with us this morning, Dr. Joe. So hopefully again we can do this again soon.
Thank you.
All right.